So, I'd like to start with a simple question. Do you believe cannabis use is harmful? Some might say cannabis is a soft drug and doesn't do any harm. Or perhaps some might say yes, because people use cannabis can get addicted to it or go on to use harder, more dangerous drugs. Or maybe you're not really sure because you don't know much about cannabis and its effects. In a very real way, your answer depends on your response to the question this presentation poses. Is cannabis a gateway drug? Well, let me tell you that the experts are divided as well. There is a lot of debate about whether cannabis is actually a harmful drug and whether it does act as a gateway drug to more hard drugs like cocaine, heroin, and more. And with 5.3 million new users of cannabis in Canada in the first quarter of 2019, it's a debate that's worth getting to the bottom of. So, what is gateway drug theory? The gateway drug theory describes the phenomenon in which an introduction to a drug using behavior through the use of tobacco, alcohol, or cannabis is related to subsequent use of other illicit drugs. The theory suggests that all other things being equal, an adolescent who uses any one drug is more likely to use another drug. In practice, early introduction to substance use for adolescents is often through tobacco or alcohol. These two drugs are considered the first gate for most adolescents. Under this hypothesis, tobacco, alcohol, and cannabis are all considered gateway drugs, preceding the use of one another and of illicit drugs. So, in a nutshell, gateway drugs are substances that, when consumed, give way to harder, more dangerous drugs. And these milder substances, such as nicotine or alcohol, are believed to open the doors to drugs such as meth, heroin, and cocaine, which can lead to addiction. So, according to gateway theory, there are two main reasons for considering cannabis as a gateway drug. First one is experimentation. So, trying a drug like cannabis increases the taste and obviously the perceived pleasure for other drugs, leading to further experimentation. When people begin using cannabis while their younger brains are still developing, which can be into their early 20s, it can change the reward system of their brains. Other drugs may in turn become more appealing. And the second one is social groups or peer pressure. When a person using marijuana associates with other people who use cannabis, then it is likely they will become exposed to other drugs and substances too. This means there is an increased opportunity and access to heavier substances. So those who use cannabis are more likely to be around others who use and sell other drugs, increasing the temptation to try those drugs. So we conducted an anonymous survey and we asked the respondents whether they consider cannabis as a gateway drug. So out of 37 respondents, around 84% responded with a yes, while merely around 16% responded with a no. So it is important to note that other factors besides biological mechanism, such as a person's social environment, are also critical in a person's risk for drug use. An alternative to the gateway drug hypothesis is that people who are more vulnerable to drug taking are simply more likely to start with readily available substances such as cannabis, tobacco, or alcohol, and their subsequent social interactions with others who use drugs increases their chances of trying other drugs. So, in a study conducted by Mr. Rashi K. Shukla in 2013, finds out that while the initiation sequence for some of the adults follows the stage-like progression identified in the literature, variations in sequencing existed. The majority of adults in this study initiated their drug experience with alcohol or tobacco. Most of them initiated their involvement with illicit drugs with cannabis. However, one third of the adults in this study reported the use of other illicit drugs prior to cannabis. But when it comes to gateway aspect of the argument, there was more to be examined. That's because substance use can depend on contextual factors such as neighborhood and community environment, level of parental supervision, and unique characteristics of the individual, including their biology and life experience. So, other research suggests that cannabis can act as a sort of anti gateway. As the nation deals with an opioid epidemic, some opioid painkillers users are moving on to other opioids, heroin and fentanyl, to satisfy their addiction. But several studies have found that medicinal cannabis legalization can actually reduce opioid deaths. Perhaps because patients can use pot to treat their chronic pain without the risk of overdose and less of a risk for addiction, instead of highly addictive deadly opioids. Similarly, cannabis legalization may also lead people to substitute their alcohol use with marijuana use. This could be hugely beneficial to public health and safety since alcohol is a fairly dangerous drug linked to violent crimes, poisonings, and fatal accidents, while legal pot is linked to violent crimes or poisonings and less likely to cause accidents. So, how can we prevent this? So, for both adolescents and adults, it's important to understand the difference between use and misuse, which is also conflated by the gateway myth. Drug use includes all problematic and non problematic drug use. Misuse can include both addictive use and non addictive problematic use, that is, driving while impaired. So, we need to be honest, reality based drug prevention and treatment programs to reduce the problematic use of cannabis by children and adults alike.